Officer Chima Mbakwem with Guam Department of Public Health and Social Services joins us now. Good morning, Chima.
Morning, Chris.
Morning. So we wanted to bring you on. Just anytime we see the double digits in COVID positives, it's always good to get you on to get more info on it. So these 16 positives, were they from weekend testing?
Yes. Yeah. They were from the 25th to the 27th.
And
so that's Friday to Sunday.
So what do we need to know about these 16 positive cases of COVID-19?
Okay, so 3 of them are military cases, and 13 of them are local cases. But out of the 13 local cases, 7 of them, like when I say local, like I'm trying to distinguish between the military cases and the cases that are on the other side of the fence. But for those on the other side of the fence, 7 of them were actually locals, but the other 6 are non-residents. So these are people that were in transit and had to get tested for COVID, and they turned positive. So we counted them as our local cases because they were tested on island, but theoretically they are not part of us.
Is there any other information you could give us on those cases? The military, so is it Guard or is it DOD?
The DOD.
And then, so what's the process when you get a DOD positive? Do they go over on the DOD side?
So when you say DOD, these are tests that were performed on base. So it could be a local resident that is either a retiree or active duty member. So why we count it as on base is because of the test was conducted at the Navy hospital. So it could be a local tomorrow, like it could be a retiree who has access to the Navy hospital. But if he has to, so if it's a local that is living off base, the case investigation is handed over to the Department of Public Health. But if it's an active duty member, the military public health handles it on base. So this has been an ongoing understanding for all communicable diseases, on the island, just not COVID.
Is there a lot of information sharing that goes on when, let's say, you guys learn of a positive case that is an active duty member and it's handled on the DOD side, or do they kind of check out after that?
No, so it's a lot of information because I think, this, like I said, this has been ongoing for a long time for other communicable diseases. So COVID didn't change our working relationship with DOD. So what it is, like when you have a case, you just need to do your first interview. That's when you determine, how you're going to handle the case. We've also had situations where we had TB cases, where the individual gets tested on base, but all the contacts live off base, Then the military would work with us to identify those contacts, and then we do the direct observed therapy for their treatment. So the case information sharing is transparent and there's nothing hidden.
So what about the other cases?
Which ones? The remaining 6. Like I explained, they were actually in transit. They stopped over on Guam and they were transiting out and they got tested and they were positive. So we isolated them, and then after that we let them travel. But they are not local cases and they were not in the community. So that particular number, we really don't have any scare with those numbers. But for the total close contacts for all these cases, we had 24 household contacts, and within these 24 household contacts, 4 actually turned positive. Yeah, and then some of them were vaccinated and some were not vaccinated at all. So it's a mixture of vaccinated individuals and vaccinated individual.
Okay, I might have missed something. Can we go back? So you said there were, what, 7 DOD cases?
No, three.
Three DOD cases.
Yeah, 3.
Okay.
Three that were reported by DOD.
Okay.
So, like I explained, it could have been like for me, if I go to the Navy hospital to go get checked.
Sure.
Yeah.
And then the other cases, so the other 13.
So 7 of them were, like I explained, were through contact tracing, and they were local cases. Okay. And then the remaining 6 were those transiting passengers that I explained to you, that don't have anything to do with the community. So it was the initial cases that we had. So out of the 7, 4 of them were actually through contact tracing. So basically it was just 3 cases that we had, and then out of the 3 cases, 4 more were identified. So you see how it pans out. So that is how detailed the case investigations are now, because the cases we are trying to make sure that we can narrow it down to the exact person. So what it was there were just 3 cases over the weekend on island, but out of these 3 cases, 4 of them were close contacts within the family unit. So it's not a community spread. And then the remaining 6 that made it 13 were those transiting passengers, and then the 3 were from the military that were reported to us.
I wanted to ask, because when we instituted this, if you're fully vaccinated and you bring all your paperwork, you get to skip out of quarantine policy. We were kind of told that the need for quarantine would kind of dwindle down, but we're still using the same quarantine facility, right?
Yes, but you also need to look at the census, and also moving forward, we're working towards reducing the size of the quarantine site, and that takes the government procurement process and the bidding and all that. So we're actually working towards reducing the size of the quarantine facility, because the number of people in quarantine has actually reduced with the change in the travel guidance.
By how much would you say?
How much would I say?
Like, what's the census for the quarantine?
I can't give you the number this morning offhand, but it has considerably reduced. From what we, from 600, from 600, 800, I think is coming down to the low hundreds. Maybe 200 or 100, around that number, but I can't be exact. So I need to look at the data from last night to be able to give you that information.
I guess just maybe offhand, Chima, nothing concrete, but let's say a flight comes in, give it to us in a guesstimated percentage. Like what percent of the people on that flight are able to skip out on the quarantine because they've been fully vaccinated and they have all.
Sometimes you're seeing up to 80 to 90% in some flights. Yeah, depending on how lucky we are, Yeah.
Oh, that's great. But no word yet on scaling down the quarantine facility.
No, we've actually met. We've actually met to discuss scaling down. We've met to discuss consolidation. So there's anytime the guidance changes, there's also the need for us to change some of our strategies. So we're actually discussing internally, but it doesn't happen in one day.
I see. What are we doing for outreach, vaccination, testing this week?
So we're continuing our outreach for vaccination. We've identified more sites that we're going to announce, or if they've not even announced it in the JIC, yesterday. We're trying to play catch up. We're working extremely hard, to make sure that we vaccinate as many people as we can on the island, because it's proven, and with the Delta variant, locking around in some of the countries around us, it's important that people, go get vaccinated to get some degree of protection in case, for any reason, we get hit. At least we will not have that level of hospitalization or people being sick. Like I always say, until the pandemic is called off, there's always, clear and present danger, one day at a time. One case, can lead to something else. So it's just being extra vigilant and ensure that people get that protection that they need. This is not the government protecting you now. This is you protecting yourself. Yeah. Because the vaccine in your arm will protect you, not me. So if you understand the need to live longer, stay healthy for yourself, your family, and the community, then if you've not gotten the vaccine, you should at least go to one of our clinics to go get vaccinated.
Chima, I want to, on that note, you said there are 4 of the 16 positives. There was 4 from a household contact, and then you mentioned some of them were vaccinated. Can you talk a little bit more about that?
Some of them were vaccinated. Yes, so some of them, with the vaccine information, I try very hard, with the team, to understand at what level of the vaccination. So, someone can tell you I'm vaccinated. It might be the first dose. It might be 3 days after their first dose. It might be 6 days. So we are still, what we know is that I think 4 of them were fully vaccinated, and the other ones we're still looking at finding out what their vaccination status is at this point, But like you said, being fully vaccinated, you can still get infected, but the things that you won't get sick, you won't go to the hospital,
And was that the case with these 4 individuals?
Yes. And like I said the last time, they were asymptomatic. So they were, so if they were not identified as close contacts, and tested and isolated, those are 4 individuals who would have been walking around the island infecting unvaccinated people, who might not be wearing their mask or keeping their safe distance from other people. So that is that balance that we always say we try to strike with, the vaccination, and also looking at the non-pharmaceutical interventions that has been in place, from the beginning. So if we strike a good balance, you're vaccinated, you wear your mask, you keep your distance, then you're not going to get sick, But if you're unvaccinated, you're not wearing a mask, someone who is vaccinated, who might have the virus, who is asymptomatic, might actually infect you who is unvaccinated, and it's going to be more devastating for the unvaccinated than the vaccinated. So it's just that balance. But it's striking to know that these fully vaccinated individuals were asymptomatic, and if they were not, contact traced, then it would have been a challenge. So that's why the team is still focused on, investigating every single case that comes across. We're not resting on our oars now because of the fact that we have vaccination. Is business as usual for us, for contact investigation. Nothing changed from the beginning. It's still consistent.
Chima, I know that you said that if you're fully vaccinated, you can still catch the virus. But if you're vaccinated and you test positive, whether you're asymptomatic or symptomatic, can you still spread the virus?
Yes, you can spread the virus, but it depends on how much you can spread. It depends on what, like if you're infected and you're wearing a mask, fully vaccinated, not fully vaccinated, you're not spreading the virus because it has to come out from, your mouth or your nose, to infect other people. So I think the level of transmissibility is not in question. The transmissibility is not in question, but is the degree that might be in question. For people who are fully vaccinated might not transmit as much as people who are not fully vaccinated. So it's just that.
Right on. Anything in closing, Chima?
Like just to end it, the challenge will be, fully vaccinated, not fully vaccinated, try and protect other people, wear your mask. But we are still having our vaccine clinics, and I would continuously encourage those who are unvaccinated, to go get vaccinated. And then for those who are vaccinated, I would highly encourage, still wearing your mask, and washing your hands and keeping safe distance, until this is completely called off. Let us enjoy the freedom, that we've achieved, with the efforts that we put in as a community, and at the same time remain vigilant and protect ourselves, so that we won't have a resurgence.
How's the turnout been at your vaccination clinics?
The turnout?
Yeah, you're still getting good turnout because we're on that. We want to get that herd immunity, right?
Yes, and the good thing is that the numbers are still encouraging. People, like the last leg of the vaccination has been determined to be the hardest. Because these are people that you need to put in more effort to convince to come out to get vaccinated. Because if they've not been vaccinated up to this point, with what is going on, maybe some of them need a little more education. I actually had an interaction with one of my good friends who told me that his staff did not want to get vaccinated, and he actually told the staff, if you're going to be front-facing, and dealing with customers, it's advisable for you to go get vaccinated. But if you don't, you're going to leave the front and go to the back, and do something else, because I want to protect my business. I want to protect the community, right? So this staff actually went out to go get vaccinated. So when the individual came back, and the question was, why did you go get vaccinated? What was your reason for not getting vaccinated at the beginning? And the individual said, there's all these stories going about, and I just didn't want to do it. But you were ready to do it for no reason. But when you realized that you were a danger to the community, and the business understood that you were a danger to the community by being unvaccinated, and wanted to take you out of your duty post to reassign you, then it becomes okay for you to go get vaccinated. So it is that lack of information that people, have. We try very hard, to push out information, but people deliberately go to Google and type, why should I take the vaccine? Yeah. Look for negative reasons not to take the vaccine. If you type positive things in Google, you're going to see reasons, you're going to see statistics on how the vaccine has been able to protect people. So
what if you type vaccine microchip mind control? What comes up?
I didn't know that when you put liquid in a human being's arm, it turns to microchip. You just look at it, it's just ridiculous.
It's the nanotech. Didn't you watch Iron Man, Chima? Huh? Didn't you watch Iron Man? There's little robots, and they go in you, and they got their hammer, and they're like, we build in, they bring in the microchip parts, each little thing, and then they each have a piece, and there's a whole assembly line, and you got to watch Iron Man.
Those conspiracy theories are, sometimes they're so ridiculous. Yeah. I'm sitting there trying to imagine.
To be fair, right, Chima, it doesn't even have to be conspiracy theory. I mean, people who don't want to get vaccinated could simply have the belief that, this was an emergency use approval. I don't think, it was on the up and up, and I'm just going to wait. I mean, that's valid. I get it, right?
Yeah, we understand, it's okay, but we still try to, engage in that intellectual discussion, try to state the facts. I'm okay to speak with anybody, my number is out there, I can get into that discussion, about why vaccines are good, It's important for us to, understand that these things are, the benefit outweighs the risk. We might have one or two, situations that might be uncomfortable, but at the end of the day, the risk the benefit will always outweigh the risk. And if your doctor says you should if you should take the vaccine, you should go take the vaccine. If public health says you should take the vaccine.
We had a couple comments here. Update of the variants on island. I'm concerned about the Delta variant. Is this the variant that can beat up the vaccination?
The study is still ongoing, but the Delta variant is not a very nice variant, but the vaccines are there to offer protection, and I think at this point we're still believing that the vaccine would actually protect us against the Delta variant, with the studies that are already out there. It's hard, but it's tolerable for people who are vaccinated. So we are actually vigilant too. We're still doing the genome sequencing, to continuously watch out for this variant. So
Chima, during the economic forum last week, the governor had made several pronouncements. One of them was that after we achieve herd immunity, when the islands reopen, she's going to loosen the mask wearing mandates. But we just heard from you that if you're vaccinated, you can still not only catch the virus, but you can also spread it. So Rosemary comments in with a question: would it be best then to continue with mask wearing at herd immunity?
Yeah, like if you listen to how the governor started, she always makes it clear that she's a nurse, so she has a very good understanding of disease transmission, right? So what she was trying to imply is, there's a mandate, for us to use the mask, in certain places, but relaxing the use of masks could be in your home, with your family members, you can relax the use of masks. But it doesn't mean that she will not encourage, the use of masks in public places where you're going to mix with people who are not your family members and people that you don't know their health conditions. So, and like you said, is reducing the mandate, not completely doing away with the mandate. I think even if you look at Japan before COVID, they were wearing masks, every day, before COVID.
Yeah.
But so her saying that is just saying, at some point some of the mandates will be reduced, but it doesn't stop us from, doing the right thing, which is, continuing to wear the mask.
I feel weird. I feel weird not wearing the mask.
Me too. I only don't wear the mask in my house.
I like it,
office.
dude. I like wearing the mask. I think it's cool. I look mysterious, right, Jay? What do you think? I look kind of like mysterious,
Yeah, so.
Well, Chima, thank you always for your input and the information that you share here on the show. You are appreciated.
Thank you so much for having me, and I hope the people won't get tired of hearing my sing-song about getting vaccinated. And I hope, and I sincerely ask people to go get vaccinated so that we can return to normal and be a little more relaxed, and live life to its fullest.
Chris,
wearing a mask, wearing a mask and being normal is the new normal. So I think the more we get vaccinated, the more we return to normal, and people will get to enjoy themselves.
Chris Cave comments in here: the Delta variant is a new virus? ? No. Can you kind of explain the variant concept just real quick, Chima?
So for every virus, so at some point they actually mutate. It's almost like trying to dribble through a quarterback, in the game of football. So for every time.
Hold on, guys. He means soccer. You don't dribble through a quarterback in American football. Chima used to play for the national team, right? Chima, you played for the Nigerian national team?
No. Wow. That is impossible. It is impossible.
No, he's a footballer. So when he talks about football, it's soccer, right? So when you're trying to dribble through, go ahead.
Yeah, so when you try to dribble through, you know, the defender is just being very not scientific, you know. It's more like the thief and the police, you know. The police will come up with a new strategy to stop the thieves, you know. They come up with another strategy because the thieves are always almost like one step ahead of the police, but the police will always catch up. So it's a back and forth. So that's what the virus is actually doing, you know. So when you get at some point they try to turn into something else, you know, to continue doing what they're doing. So not being too scientific, it's just the virus changing strategies, you know, on how to continue multiplying and infecting people. Let me not get too scientific.
Thank you. Appreciate it, Chima.
Thank you so much for having me.
Of course. We'll see you. Have a good day. That's Chima Mbakwem,
Thank you.
the acting chief public health officer. You know, very consistent with his messaging, Jay. I like what he said there. He's like, I hope you guys get tired of hearing me. I hope you're not tired of hearing me say the same thing. But
he called it his sing-song message. But you know,
Yeah.
the one thing
his
though,
sing-song message.
we know here because we run, you know, like a music radio station. You
Yeah.
play a song long enough, it gets in
in
people's
your
heads
head.
and it gets sticky,
Yep.
and it catches on.
That's
So
it.
we hope that would be the case with Chima's message.
Yeah, so Chima, anytime you want to come on and do the same sing-song message, shoot me a WhatsApp. Okay, there you go. Take it easy. 9:09. We're going to take a quick break, guys. All right? Because it always gets my heart rate up when we talk about these positives. And coming up, we are going to stick with public health. How's that, guys? The theme here.
Oh, we got a double dose.
Yep, we're getting a 2